Welcome to Module 2. These are the lecture series based on the questions that you've asked from the reading for Module 1 and Module 2. We take these questions from you and group them into categories using similar themes and trying to find out the sorts of things that might be most helpful for you as you proceed. We try to showcase good questions, answers, and resources, and sometimes you'll see that we answer parts of your questions in the grade book as part of your feedback. Sometimes we sneak it into the discussion board to publicly answer because many of the questions are good, and we hope that you'll begin to see many of your questions are answered in really great ways by the fellow students, and we hope that these sorts of things will help us create a whole community discussing these issues. The last part of the questions we ask is what you found interesting or useful. And we do that partly because we find that as people create their understanding, they sometimes help us see what's interesting and how to highlight things. It also cheers us up and distracts us from Blackboard and the course logistics. We like to know what interests you and what connections you make. One of the questions that came up a lot was having to do with, there are a lot of initials, a lot of jargon, a lot of letters. What is all this stuff? What does it mean? And I just want to say there's a continuum of concepts that are expressed here and that go as acronyms. And the first one, going from the simplest to most complex, is a community health profile. And this is going to be a picture or a profile that describes the community and probably its health. It's going to look at and talk about this is who the community is, this is who it's made of, and it's going to try to give the reader maybe not conclusions, but a good description. The next is a community health assessment, and these include the features of the community health profile as well as more needs assessment and assets descriptions. And we will go into the assets in Module 3 when you do your interviews. The number 3, the community health improvement process, is all of what's in number 1 and number 2, but there's a commitment to improve the health of the community. And so there's going to be a process where prioritization of problems happens, including information about what the interests are of people and the strengths of organizations and that sort of thing, and the commitment to particular sorts of intervention strategies, plans, so that in a health improvement process, it's a much longer commitment, and you are, in fact, trying to make a change over time. If someone asks you, oh, you should come and do a community health assessment, you need to be getting clarification about what they're actually talking about. We might refer to a profile, but it may have elements of a community health intervention process or the assessment. So it's always good to ask more questions about what particularly is being requested. For example, do they want an analysis of problems and assets? Do they want strategies named to improve the health of the community? As someone said, I navigate the readings. I notice many of them mention a lot about community assessment itself. However, many fail to mention anything about interventions or strategies. Is an assessment only the basis for establishing the factors that plague the community and not so much the strategies for intervention? So hopefully that's clear now. Some people actually view epidemiology as something that's just supposed to describe and give the information and not to make those decisions, whereas other epidemiologists, myself included, might say, no, I think it's our obligation to begin to suggest strategies and to provide the information about community interests, other factors that would go into what kinds of things might actually work. So to some extent it's a philosophical difference, and sometimes it's described in terms of the kind of heading or title that somebody would give it. So more about the community health improvement process. There were questions about this. So for example, how does one select the health issues that the community will address in the implementation cycle? How many issues should be selected, and how is it carried out? We'll go over some of that more. Because of the limitations of an 8-week course, we are calling this a community health profile so that we, in fact, end up with a product that describes the community. We are not planning on you fixing it, since that would, in fact, take quite a long time and require that people want it to be fixed. the issues that are selected, there is a process, what I call a mix of the public health, the public health so what test and a good appreciation for what it is that people want to do. The so what test is what issues are important, what is the prevalence, the incidence, what political support goes for certain kinds of things. Are there things that are more acceptable to work on? Are there resources? So that you might look at the issues, a community would look at the issues together and then perhaps make a priority listing based on things that they can do, things about, that sort of thing. We will do some priorities setting later in the course. So the next question, in addition to the community guide, are there other resources for effective public health strategies and interventions? There are some wonderful resources. The community guide was put together by CDC. This is in the resource list in the course, and we will look at these. Certainly you'll see them in epidemiology. I think you'll also be linked to them here. There's also the United States Public Health Service Task Force Guide to Clinical Prevention Services and the Cochrane collaboration, and I'll put up links with this, the SAMHSA, and there's then the peer-reviewed literature based on clear epidemiological studies. And so those would be how someone might decide that some resources, that the interventions are effective for given public health problems as they are described. Implementation and evaluation are steps described in both CHIP and MAP, but these are, again, not a lack of, they're not focused on in the community health profile or the community health assessment because of the continuum of activities as we describe. Is there a reliable approach for measuring the effectiveness of public health organizations and agencies in improving the health of a population? MAP and APEX both try to get at this. You're trying to get a sort of thumbnail view of, can this public health department or can this government in a locality or the sorts of agencies, how are they and how effective are they at doing this? And I'm not sure that I would say there's a reliable approach, but there are attempts to describe the capacity of organizations to do what it is that needs to be done. Is there any hope of implementing health improvement plans with the current lack of resources? Well, I'd say there's always hope, but it is a constraint. And with the defunding of many public sector activities, that's been difficult. Now, with the Affordable Care Act, that has given energy to these kinds of activities. And in some respects, I think that entrepreneurial public health students, by becoming familiar with community assessment and helping communities see ways to invest and engage in public health, that it would in fact be lots of reasons for being hopeful. How often are the health issues identified in a community health assessment addressed and resolved? Well, not as often as anybody would like, and a lot of that has to do with that the process is long. It involves building a lot of investment by the community, getting the people involved, both the opinion leaders, the right, political leaders, as well as the people who do things. And the problem really is that often people are impatient. The process is frustrating, and there may not be enough product for people to get involved with, but there needs to be a lot of good process to help people so that they can make good product, but enough product to make people feel like they're not drowning in process, if that makes sense. How effective and applicable is the CHIP process to different communities and situations? I think that they've done a good job with many of these processes, both in the community health assessment and CHIP, to really give a generic description to the process. I use it in many types of public health work that I do to help me systematically look at communities or even problems and make sure that I am keeping track of the kinds of things that need to be done in terms of engaging communities, checking with stakeholders, looking at organizations. So I think that it's applicable to many public health processes, and it is applicable to many communities in different situations. It does have to be adjusted. When we talk about the ways that you have selected your community and what that implications there will be in being able to get data and how much you have to rely on qualitative data and quantitative data and that sort of thing, I think you will begin to see that the tools, some of them are more weighted towards epidemiologic data, some of them towards qualitative, but usually they're more interested in the epidemiologic information.